So the low-hanging fruit for the Internet of Things is just tag my things, connect my things, find my things. But the differentiator, and what makes us different, what could make you different, is the ability to monitor my things and start to create predictive analytics around my things. This is more than just where's the wheelchair. It's where's the wheelchair been, who's using the wheelchair, how are they using it, and how many wheelchairs do I really need? So that's what the Internet of Things can be and is already becoming today. Here's a good statistic for you. The ROI for a hospital of 150 beds, if they implement tracking all of the assets and the analytics around it, the ROI is 22 days to pay for all of the technology required to do that. We can take about $1 million out of a 150-bed hospital every year in expenses. The low-hanging fruit, the easy stuff, is where are my things? Where's my wheelchairs? 25% of a nurse's time is spent looking for equipment. Now, this is verbatim from one of our customers. They told us in one of our first meetings, there's no way in hell we will track our employees. Then we told them 25% of a nurse's time is spent looking for the people he or she needs to provide care. Then all of a sudden, you know what? A little tag on the lanyard might not be such a bad idea. And if we bought their phones for them, we can put a tracking application on their phone because we own the phones. We can do whatever they want. Changed very quickly. So 1/3 of a nurse's time is spent providing care today. Hospitals have 40% on average more equipment than they need. And why? Because they can't find their equipment. So they go buy more equipment. And because different wings or different parts of the hospital can't find the equipment, they hoard the equipment. And so they go buy more equipment. And so what we're talking about doing with the Internet of Things is a simple map of the hospital with little marks where all of your assets are, and the marks are actually color-coded. So they're color-coded green, yellow, red, and if they're green, they're ready to be used, they're not being used, go grab them. If they're yellow, they're within 2 weeks of needing maintenance, and they're smart. So the assets raise their hands, and they tell the maintenance organization when they need maintenance and where they're at. And if they're red, you shouldn't go use them. So we're already impacting patient care with that. One of our new networks that we're working with is actually talking about taking all of the information. So we're talking about tracking employees with these or by putting an app on their phones. We're talking about tracking patients with a little wristband. We're also working right now on a little patch that will go on patients. And so it will return proximity of the patient, but it will also return temperature and heart rate. So if there's something going on with a patient, we'll know a lot sooner than that. But think about the power of knowing where all of my assets are, where all of my employees are, where all of my inventory is, where my patients are, and all of the information about how they crisscross and interact with each other. Now I can understand how many wheelchairs and blood pumps I really need. And one of the hospital chains that has already put real-time location services in saved $2.8 million in the first year, getting rid of all of the leases that they had for equipment that they didn't really need. So one of the first things you'll hit, especially if you're aligned at the IT space, is RFID. RFID was a great starter for the Internet of Things. It had a great place. We're using it, all of you are using it if you're staying here to get into your room. But what's the issue? You got to actually touch it to that little thing at your door. And think about what happens in a hospital. You tell them they have to take a piece of inventory or an asset into a room and they need to scan it in. The next person might just take that piece of inventory or that asset right out of the room, forget to scan it, so you don't know where it is. With Bluetooth Low Energy and what I'll be telling you about in a few minutes, it's 100 feet. Broadcast 100 feet, broadcast every minute instead of every 5 minutes. Batteries last 4 to 6 years. So there's a complete change in technology. This is a huge paradigm shift. We can deploy a patient wing with Bluetooth Low Energy in about an hour. It takes about 3 minutes to deploy a patient's room. So it's a big, big change. So we also have temperature, we have accelerometers, and we have humidity on our beacons. So when we talk about making things smart, we really need to make them smart. It's not just about where they are, it's what's going on around them and who's using them. So when we take back 3 layers of data. Structured proximity, the Internet of Things, where are my things? We take back surrounding metadata. What's the temperature around my things? What's the humidity of my things? When were my things last maintained and when are they due to be maintained again? So that's structured, and that's structured metadata. But we can also go look at a physician's log or a nurse's log. And here's what happens. So our cognitive computing layer will actually find out that the sentiment here is negative. It finds was not. So then if it's negative, what was going on in that room? There was a blood pump in that room, and it was a broad blood pump. And it looks like it didn't do what it was supposed to do in the beginning. So now it knows to tell us that there's an issue with the blood pump. We know the serial number, the model number of the blood pump, and because we've created the Internet of Things, we can even go out and see if there are any recall notices on that brawn. While our Internet of Things solution notifies maintenance that it needs to go get broad pump serial number 235, and it tells it exactly where it is. A big change in how the world will operate going forward. So here's our shameless plug for how we're doing it. We do it with a product that we call THINaer. And THINaer makes any asset immediately smart and connected. So we use little beacons like this. It was one of those career moments. I got a text message from a friend who was at a hospital where somebody he knew was having surgery, and he sent us a picture of a blood pump, and it had a little tag on it. He said, "Isn't this cool?" So that is cool. That's us, right? That's THINaer. So this is how we tag things with these little tags. You zip tie them on. We're working on a new attachment that will actually set off an alarm if it gets broken. And the reason we're doing that is we've been asked to track patients. So this is one of our first prototypes for how we'll track patients. We're also working on the patch. We can't use a patch on a baby, so we're working on a little tiny thing that will attach to their ankles. And believe it or not, babies were the first thing we were asked to track. And I said, we'll be happy to do that. Let's make sure we can keep your wheelchairs inside the four walls before we get off and onto the baby. So we have built a platform. But the biggest difference in ours is ours understands healthcare. Our platform understands oil and gas and energy. It was built for the enterprise, where Amazon and IBM built for anybody that wanted to deploy a bag of beacons. We do IoT certification workshops at our office in Richardson, Texas, at the Advantix office. We've had Fortune 500 companies attend. IBM's attended. Vizient, one of the largest healthcare companies, has attended. We actually take you deep into IoT and how you can build a solution around the Internet of Things.